Very good afternoon to all of you. Myself Nirupama Mishra, tutor, College of Nursing, VIMSAR, Burla. I would like to teach you a topic from COVID-19. See the image and guess something. What may be the topic? It's okay. The topic name is Immediate Implementation of Infection Prevention Control Measures. Introduction of IPC measures. According to Henry de Brockton, an ounce of prevention is worth a pound of cure. It means if we put a little effort to prevent a problem, then we have not to put a lot of effort to solve the problem. Nowadays, COVID-19 is a highly infectious or contagious disease that spread from person to person, and footfall or admission rate in the hospital is increasing day to day. While rendering services, there is chance of hospital-associated infection. It is shortly called as HAI. In this context, aim of healthcare delivery system is to do no harm to anyone, and it can be possible only by immediate and strict implementation of infection prevention control measures. It is a scientific approach and practical solution designed to prevent harm caused by infection from microorganisms to patients and healthcare workers. In healthcare facility, transmission of infection from patient to patient, patient to healthcare personnel to patient, and healthcare personnel to healthcare personnel. Prevention and precaution are like the two sides of a coin. They are interrelated with each other. Now we will discuss regarding the types of precaution. It is mainly divided into two types. One is standard precaution and another one is transmission based precaution. First one is the standard precaution. What is standard precaution? It is the precaution that apply to the care of all patients in all healthcare settings, irrespective of their disease state. It means whatever may be the disease and wherever may be the healthcare setting, the patient is staying application of standard precaution is same for all or everyone. This precaution may apply when there is a risk of potential exposure to what? Blood, body fluid, mucous membrane, and non-intact skin. Measures of standard precaution. There are mainly 8 measures of standard precaution. Number 1 is the perform hand hygiene. Number 2, use of PPE. Number 3, respiratory hygiene and cough etiquette. Number 4, prevention of needle stick or sharp injury or safe injection practices. Number 5 is the cleaning and disinfection of devices and environmental surfaces. Number 6 is the spill management. Number 7 is the workplace management. And number 8 is the safe biomedical waste management. We will discuss it later one by one. First and foremost, standard precaution is performing hand hygiene. Hands are the main pathway of transmission of germs. So, maintaining hand hygiene is very important to prevent infection. Hand hygiene is also called as hand washing. It is the act of cleaning hands with soap, hand washing solution, or alcohol-based solution to remove virus, bacteria, microorganisms, dirty substances, and other harmful substances. See the poster of hand hygiene of Health and Family Welfare Government of Odisha. When to wash your hand? First one is the before and after touching a patient. रोगी को छुईबा पूर्वरु ओ परे. Second is the before clean or aseptic procedure. That is the संक्रमण मुक्त पद्धति पूर्वरु. And third one is the after touching patient surrounding. रोगीर चारिपाखरे थिबा पदार्थ छुईबा परे. And fourth one is the after body fluid exposure risk. That is शरीररु निर्गत तरल पदार्थ छुईबा परे. There are mainly 7 steps of hand washing. Number 1 is the rub palms together, rub the back of both hands, then interface fingers and rub the hands together, then interlock fingers and rub the back of fingers of both hands, then rub thumb in a rotating and downward manner, followed by the area between index finger and thumb. After that, rub fingertips on palm for both hands. And the final step is rub both wrists in a rotating manner, rinse and dry thoroughly. According to WHO, 5 golden rules for hand hygiene. Number 1 is the hand hygiene must be performed at the point of care. It means where you provide the care, there you must wash your hand properly. Then number 2 point is the during care delivery, there are 5 moments. It is essential to perform hand hygiene. The 5 moments are: first one, the before touching a patient. Second, before clean or aseptic procedure. Third, after body fluid exposure risks. 4, after touching a patient. 5, after touching patient surroundings. These 5 steps is also called as my 5 moments of hand hygiene. Third golden rule is hand rubbing with an alcohol-based formulation. If available, makes hand hygiene possible at the point of care, is faster, more effective, and to be better tolerated. And number 4 golden rule is hand washing with soap and water. It's necessary when hands are visibly soiled or dirty. And number 5 golden rule is the appropriate technique and time taken to clean hand is also very important. Follow these 5 steps every time. Wet hands, apply soap. Leather hands or bubbling the hands. Scrub at least 20 seconds. Rinse hands, dry hands. Drying of the washing hand is part of the process, as wet and moist hands are more easily recontaminated. So always dry your hand before putting gloves or before doing any work. Use hand sanitizer if washing is not an option. Must be at least 60% alcohol based. After washing hands, wearing of gloves is very necessary to prevent infection. So every nursing personnel should know the gloving technique properly. Gloving technique is mainly 2 types: open gloving technique and closed gloving technique. In open gloving technique, for sterile tasks performed by non-sterile team members, and in closed gloving technique for applying sterile surgical gloves after the sterile gown has been donned or put on. Both open gloving technique and closed gloving technique steps are same, but in closed gloving technique, the cup of the gloves is put above the wrist of PPE kit or above the wrist of any sterile gown. The steps of gloving techniques are: number 1, pick up one glove with thumb and forefinger or index finger, as like the picture. Pull glove on hand. Number 3rd step is slip partially gloved hand under cup of second hand. And number 4, pull second gloves over other hand and pull glove up or gowned wrist. Number 5 is the slip fingers of completely gloved hand under cup of first hand, pull glove is gowned wrist. And number 6, this is the final gloved procedures completed. After performing any procedure, gloves should be removed in a proper way. During removal of gloves, contamination rate is very high. So use proper technique while remove the gloves. It is also called as beak method. Beak means what? The hard pointed part of a bird's mouth. This gloves removal technique has 6 steps. Number 1, using one gloved hand, pinch and pull the base of other gloved hand, it's like the picture. Number 2, use the middle finger to scoop the cup of the gloves. And number 3, pull the glove inside out over all the fingers and thumb to form a beak. It's like the hard pointed part of a bird's mouth, that is the thunder, like thunder. And number 4, with the beaked hand, pinch the opposite gloves at the base and pull the cup. Number 5, roll the glove inside out and up the hand. And number 6, with the ungloved hand, use the index finger to pull the beaked gloves up at the base of the beak and dispose into appropriate waste container, as like the picture. Always wash your hands after glove removal. Number 2, standard precaution is use of PPE. What is PPE? PPE is the personal protective equipment. It protects ourselves from different infection. It contains disposable hood, disposable non-oven gown, 3-ply mouth masks, that is the triple layer surgical masks, surgical gloves, disposable eye gear or goggles, and disposable shoe cover. See, one COVID warrior is wearing a full set of PPE kit. As a nursing personnel, you have to know how to wear the PPE kit and how to remove the PPE kit. There are several steps how to wear the PPE kit and how to remove the PPE kit. First is the donning method. Before wearing the PPE kit, first wash your hand thoroughly by the 7 steps. Then wear PPE kit, then wear masks, then wear goggles, then wear gloves. And in the doffing method, first remove your gloves in the red bucket, then remove your PPE kit, then remove your goggles, then remove your triple layer surgical masks, then wash your hand thoroughly. You should remember, risk of self-contamination is very high when removing PPE. Third standard precaution is respiratory hygiene and cough etiquette. To maintain respiratory hygiene is very important to prevent or to avoid COVID-19. Wear your mask properly. It comes all the way up, close to the bridge of your nose and all the way down under your chin. Keep it snug to your face. Means your mask should be fitted properly, that not loose and that not tight. Cover your mouth and nose with a tissue to cough and sneeze, then clean your hands thoroughly. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow. It's like the picture. Third, standard precaution is prevention of needle stick or sharp injury or safe injection practice. What is needle stick injury? Needle stick injury is the accidental skin penetrating wound caused by needle, scalpel, glass, blade, etc. Nurse's role to reduce the risk of sharp injury are what you do and what you don't do. What you do? Use needle cutter or destroyer. Then separate sharps from other waste. Don't mix with other bin. Use rigid puncture-proof disposal bin. Empty sharps container when they are third-fourth full. When the container is third-fourth full, then empty the container. Don't wait to completely full. Then what you don't do? Handle, empty or transfer used sharp between containers. Do not recap sharps. Don't recap the sharps before disposal. As a nursing personnel, you have to know the 7 steps of safe injection practices. First one is to clean your workplace, then to maintain proper hand hygiene. Third one is the sterile safety engineered syringe. What is the sterile safety engineered syringe? It means always use a new syringe, packed syringe. Then sterile vial of medication and diluent. Use skin disinfection and appropriate collection of sharps. Don't put here and there. Then 7 steps of safe injection practice is appropriate waste management. If NSI happen unfortunately, then don't be panic, be calm and quiet and do action immediately. First, wash the hand with soap and water. Don't apply pressure to the infected wound. Allow it to be bleed freely. Then identify the patient involved from whom you are injected. Then immediately report your injury to your supervisor. Do not wait until the end of your shift or the end of the procedure. Follow the direction for any necessary blood test, vaccination or medication to prevent infection. Then document the incident in the forms provided by hospital, that is OVR and EPI net form. What is OVR form? OVR is the occurrence variance report form and EPI is the exposure prevention information network form. The 5 standard basic principle measures is cleaning and disinfection of devices and environmental surfaces. As a nursing personnel, it is important to ensure that cleaning and disinfection procedures are followed consistently and correctly. All surfaces in healthcare facility should be routinely cleaned and disinfected, especially high touch surface or wherever visibly soiled or if contaminated by body fluid. To clean the surface with water and detergent first, then to apply disinfectant solution, that is sodium hypochlorite 1% or ethanol. And the equipment should be cleaned by ethyl alcohol 70%. If not more required, then don't touch wall, switchboard, etc. If urgent, then touch the wall or switchboard with a tissue paper. If tissue paper is not available, then touch with a plain paper and discard the paper appropriately. If blood and body fluid unfortunately pour down in the floor, then don't be panicked. First wear PP, then cordon cover with absorbent or pour fresh 1% sodium hypochlorite. What is cordon? Cordon means demarcate the area, then on that pour down substance put a newspaper or a cotton clothes. Then wait for 20 minutes. After 20 minutes, discard in yellow bag. Then wash your hand. Then replace content of spill kit. Then record in. To prevent infection, your workplace should be clean. And the workplace management rule is 5S. What is 5S? Sort, set, sign, standardize, and sustain. Sort is the identify and remove unwanted, unused item from the workplace. Remove and identify the unused and unwanted items. Then set in order. Organize everything needed in proper order for easy operation, or a place for everything and everything in its place. Then sign. Maintain high standard of cleanliness in your workplace. Clean and inspect or inspect through cleaning. Then standardize. Make up the rules, follow and enforce them. Then sustain. Part of daily work, and it's become a habit. It should be a continuous process, not an intermittent process. A real example of before starting the medication and after starting the medication. Number 8, standard basic principle is safe biomedical waste management. As a nursing personnel, you have the complete knowledge regarding segregation of hospital waste management. In green bucket, put kitchen waste, paper, tissue, water bottles, can, etc. And in red bucket, put syringe, gloves, plastic waste. And in yellow bucket, put soiled anatomical part like placenta, chemical liquid, cytotoxic, laboratory waste, expired and discarded medicine. Then in glassware, antibiotic vial, metallic implant, glassware material except cytotoxic drugs. And in the cherry red color bin, used for needle and cut glasses. See the real image of our COVID ICU. There is a COVID warrior putting her gloves in the red bucket. Then transmission-based precaution. What is transmission-based precaution? It is the set of practices specific for patient with known or suspected infectious agent that requires additional control measure to prevent transmission. It's specific for patient, used in addition to standard precaution. Wear PP for contact and droplet precaution is must. Use disposable or dedicated patient care equipment. Dedicated means what? The sharing patient care equipment. If equipment needs to be shared among patients, clean and disinfect it between use for each patient by using ethyl alcohol 70%. Use adequately ventilated single room, preferably, or dedicated COVID-19 wards room with dedicated bathroom. What is dedicated COVID-19 ward? That is the general ward, COVID-19 general ward. With dedicated bathroom means the sharing bathroom. In that case, the bathroom should be cleaned at least twice daily. Or if possible, after every use, please disinfect the bathroom. Then avoid transporting COVID-19 patient out of room unless until medically necessary. Place a mask on COVID-19 suspected or confirmed positive cases if transport out of room is medically necessary. Healthcare workers should wear appropriate PPE during transport to prevent infection. Then restrict the numbers of visitors allowed because COVID-19 is a contagious disease. So to decrease the spread of transmission, COVID-19 IPC priorities. There are mainly 4 IPC priorities. First one is the rapid identification of suspect cases from family members and relatives. For to identify, screening or triage at initial healthcare facility, and rapid implementation of source control. Then limiting entry of healthcare workers or visitors with suspected or confirmed COVID-19 because it is a contagious or infectious disease or transfer from one person to another person. So be cautious. Then second IPC priority is immediate isolation and referral for testing. Group patient with suspected or confirmed COVID-19 staying separately. Test all suspected cases for COVID-19. Then third IPC priority is safe clinical management. Immediate identification of inpatient and healthcare worker with suspected COVID-19. Then number 4 IPC priority is adherence to IPC practices, means use PPE appropriately. Implementation of IPC at triage. Provide triple layer surgical masks to the suspected patient and provide a isolated room to a direct patient that is confirmed COVID-19, confirmed positive COVID-19. Maintain at least 1 meter distance. Instruct all patients to cover nose and mouth during coughing or sneezing with tissue or flexed elbow for others. Perform hand hygiene after contact with respiratory sickness like coughing, sneezing, etc. Apply droplet precaution. Use a triple layer surgical mask with properly fitted. As on earlier picture, when providing care in close contact with a patient with respiratory symptoms, coughing or sneezing, use eye protection like face masks, goggles, face shield, etc. because spray of secretion may occur. Limit patient movement. What is limit patient movement? Limit the patient movement within the health center or within the ward to reduce potential infection throughout the healthcare facility. Apply contact precaution. What is contact precaution? Contact precaution is a measure used for disease caused by microorganism that may be transmitted easily by contact with the patient intact skin or with contaminated environmental surfaces. The contact precaution measures are performing hand hygiene to prevent cross-infection, using PPE kit while entering ward or room, removing PPE kit while leaving the room or ward, then disinfecting equipment while sharing with ethyl alcohol 70%. Refraining touching body parts unnecessarily to prevent infection that may be gloved hand or that may not be gloved hand. Avoiding contaminating environmental surfaces, ensuring adequate ventilation in the room to prevent infection. Apply airborne precaution when performing aerosol generating procedure. What is aerosol? An aerosol is a suspension of fine solid particle or liquid droplet in air that comes from mouth and nose. During some procedures, the aerosol generating procedures are endotracheal intubation, bronchoscopy, cardiopulmonary resuscitation, tracheostomy, and autopsy procedures, etc. For performing aerosol generating procedure, don't forget to wear PPE kit with N95 respirator. The schedule fit test should not be confused with user seal check before each use. Before use PPE kit must check the seal, is seal or not. Then whenever possible use adequately ventilated single rooms when performing aerosol generating procedure. Avoid the presence of unnecessary individual in the room because to prevent infection. Then care for the patient in the same type of room after mechanical ventilation commences. Thank you a lot to listening my teaching patiently. Thank you.